What happens with addiction is that when we take a substance, when we're exposed to an activity that helps us release extra dopamine, that reinforces that I'm going to do that again. Well, the natural reinforcers of food and sex and friendship and novelty, those are things that we're supposed to be doing to pass on our genes. But there are ways to hijack that. If we hijack that same pathway with heroin or cocaine and we release lots of dopamine, that's a reinforced behavior. We could just as easily hijack that behavior or that pathway with chocolate cake or with gambling or with pornography. Any of those addictions are going to be just as biologically real as an addiction to cigarettes. And they all essentially work the same in the brain. So what happens is we've been exposed to this substance, we release a whole lot more neurotransmitter than we typically would. So more dopamine is put into that space. Well, that means I used up a lot of the dopamine that I had. It also means that there are not enough receptors for the dopamine that I put into the synapse. So now the next cell is going to make more receptors because it's seeing more. What happens then is the nerve that's making the neurotransmitter gets depleted of that resource to make more, and the nerve receiving the message has all of these extra receptors. Well, now just a typical amount of neurotransmitter wouldn't even be enough to satisfy the nerve receiving the message because there's too many receptors. Moreover, the nerve sending the message can't send an appropriate message, a normal message, because there's not as much neurotransmitter there. So on both sides of that synapse, there's a problem that results. The things then that we see is a difference in withdrawal, which means I'm using less of the thing, and so now I've got to downregulate the receptors on the receiving side of the synapse. But the other side of that is I don't have enough neurotransmitters for a normal message to be sent, and that doesn't downregulate or upregulate as quickly. So how do we fix the problem? Well, the first step is to stop using that substance and have a downregulation of neurotransmitters. Well, that first step is really hard. How does a person stop using a substance to help the receptors go back down? Detox solutions, things to help people go through a detox, are very helpful, because that part of withdrawal where an alcoholic has the shakes or an opiate addict is throwing up and having diarrhea, or somebody that's been smoking cigarettes has headaches and trembling, caffeine with their headaches, all of those things, there's going to be a withdrawal as the receptors are downregulated. That side happens relatively fast. Generally it takes somewhere between 3 days and 2 weeks. The side of the addiction that persists is the neurotransmitter side. The nerve that was sending the message can't send as strong a message as it initially was sending under normal circumstances because there's not as much neurotransmitter to give. It's used up too much neurotransmitter when it overspent. So we have to give people the building blocks for neurotransmitters, and those building blocks for neurotransmitters are amino acids. The pathways that you take an amino acid and make it into a neurotransmitter are well understood. You've probably all heard the sort of wives' tale that after Thanksgiving you're going to be really tired because you ate turkey and turkey has tryptophan. The reason that rumor exists is because tryptophan is in fact the precursor for serotonin, and serotonin is the precursor for melatonin, which makes us tired. So we know this. These pathways are well understood. Essentially, you've got tyrosine, which will become dopamine. You've got choline, which will become acetylcholine. You've got tryptophan, which will become serotonin, and glutamate, which will become GABA. So each of these neurotransmitters we need is made from an amino acid. Now, amino acids are made, they are the things that protein are made up of. A string of amino acids is a protein. So in normal circumstances, in normal healthy life, we're eating protein, we're getting this resource, and we're taking that resource and we're making some of it into neurotransmitter. Once you get behind and you don't have enough dopamine or you don't have enough serotonin, it's really hard to make up the difference by having a T-bone steak or more lentils. It's just nearly impossible because the body's low in protein to start with, and it's going to send that to muscle building before it's going to send it to the brain. If, however, we give you those amino acids individually, instead of as a protein, you don't have to chop them up, but we give you free-flowing amino acids, and we give it to you intravenously, now, and at a nice slow rate, once your muscles are like, oh, I've got all the amino acid I can handle, your brain's going to start to absorb those amino acids, and you're going to start to turn those amino acids into neurotransmitters. What the research shows is that if we give you those amino acids intravenously, you're going to have remarkable improvement. Not just with the addiction because you've got low neurotransmitters, but also with the withdrawal because you're able to make a little bit extra neurotransmitter as you're down-regulating receptors. So withdrawal phase of addiction recovery is made less severe, which is nice. But more importantly, the back end of addiction, which is even though I've stopped using this substance, I still think about it every day. It still controls me too much. That actually can be healed. By giving people intravenous amino acids, we'll reduce their need or we'll reduce their fixation with that because we'll reduce their need for constant dopamine. We'll just give them the resource to make dopamine. IV amino acids are the most potent. Oral amino acids are also very effective. They take longer to work, but in a perfect world, what we do is we give people IV amino acids, and then on the back end, they continue on oral amino acids for months, maybe a year or two, at which point now nutritionally they're doing so well that they could probably stop oral amino acids. It depends patient to patient. Sometimes staying on oral amino acids for several years is a good idea. To sum up, I would say there's a lot of solutions. Each solution is important. I'll sort of go over them. When we restrict access to the addictive drug or the trigger, that's helpful, right? It's got a lot of legal and moral implications. Restricting access isn't a solution by itself. Psychotherapy is critically important. I didn't get into that at all during this presentation. There are reasons that we seek more dopamine. If a person's been abused, if a person's got a detachment issue where they feel like they've undergone, and I'm not the expert on this, they've undergone emotional trauma, they're going to need more dopamine, and so they find ways to get that through addiction. Psychotherapy is critically important. I can't stress that enough. By itself, though, it didn't fix the biology. It got to the underlying reason why they need more dopamine, but it didn't give them more. We can medically eliminate effective triggers. That's like giving naltrexone or giving them a substitute. Again, that's not really solving their biology. All by itself, I say this is a partial solution. We can fix the pathophysiology with amino acids. That's only a partial solution because it doesn't address the underlying psychotherapy that they need. With all four of those things to do together, I think with an integrated and coordinated approach, absolutely we'll have success. And I think addiction can be treated medically with just as much success and just as much optimism as we treat any other medical disease. When people have, they find out they have diabetes, they don't think, oh, I'm broken forever, I give up. The rate of suicide, the rate of becoming incapacitated from work is far too high with addiction because I think we're so hopeless to help to make a difference. If we'll do these things, I have every confidence that we'll get people all the way better. Thank you for watching.